buen día, permiso.
Yeah, welcome again.
This is our visit from the university. Lynette and Nico, they are with the ROP department.
Hi again.
Hi. So I don't know if you want to explain a little bit what you do.
Sure. All right. Okay, I'm being taped tonight.
Yeah, okay.
We're sorry for my lousy English. I try to do my best. So, perdón si la mata, si meto la pata. Okay, what we do here in this area, we have the Cornea Bank and the ROP department. ROP, you are familiar with those terms? Retinopathy of prematurity? Oh, great. Well, Lynette, she's the coordinator. I'm her assistant, suddenly her left foot sometimes, and sometimes it's her right hand. So what we try to achieve is to avoid the blindness caused by ROP on the premature babies. We work at 10 hospitals at this time. Most of them, now, all of them are hospitals from the Ministry of Health. So we're practically taking coverage of 50% or 60% of the Ministry of Health need on the ROP department, to say like that. We use telemedicine, and our doctors goes also to the hospitals to confirm the diagnosis. We use a RedCam, and now we have a RetiView. It's a new wide field camera. We take pictures of the retina till, let me show you. I got a model over here. I try to not mess up with this because see that. It is there. So this is our eye. This is the cornea. This is the iris. That's stereo.
Like that's what it is.
Yeah. This is the lens. And this is, I didn't remember quite well in English, like vitreous humor maybe? Good. Vitreous?
Humor vitreo, we call it in Spanish. It's like...
It's kind of like a,
Humor.
it's like a gel inside of the eye that keeps the form of the eye.
Mm-hmm.
So, and this is the retina over here. What the ROP is with premature babies, the retina is not fully developed inside of the uterus. So the brain like thinks that now that we are outside, we have to develop really fast. Mm-hmm. So what happens is from this optical nerve that connect the eye to the brain, grows these vessels. When the premature baby borns, these vessels grows like through here. So the brain starts to develop these vessels pretty fast, so they grow up in a pretty bad shaped way, and they explode on the ends. That create a scar, and that scar tissue is like pull the retina, leading to a retinal detachment. And those are in the advanced stages of ROP. So what we do is with the wide field camera, we take pictures of the retina, and so we see how the vessels are growing and to where. So if the doctor, we upload those pictures to a Dropbox, and the doctor access to that Dropbox and see the pictures and the images. I just made up a new word.
Images.
He says he's diagnosed.
Assess.
Emitir.
He like says the diagnosis. He like make the diagnosis.
He made a report with the diagnosis of the baby.
Yeah, he assesses the images to make a report and then diagnose.
Oh, thank you.
The baby. You were good.
New words. That's good. I already knew that Netflix won't show me everything. So. Well, according to that diagnosis, they decide if they're going to see the baby again in 1 week, 2 weeks, 1 month, or if the doctor sees something that is weird or is calling his attention, he goes to see the baby with ophthalmo no, it's like ophthalmoscopio binocular indirecto. Indirect binocular ophthalmoscope is that that helmet they put on with those two glasses on it and the light, and with a lens, 28 diopters lens, so that they used to see inside the baby. So then they decide to do another checkout or to see the baby again in 1 week, 2 weeks, or if he needs a treatment. If the baby needs a treatment, we have 72 hours to perform that treatment.
Like they cannot, it may not occur the first week of born, so they have to make the controls like every week and so to make the diagnosis, and when they diagnose it, they have like the 72 hours to make the treatment.
How many weeks do they have to go back?
It depends.
Like how long? It could be like 6 weeks. It could be.
Actually, the premature baby stays in the neonatal care unit like maybe 2 to 3 months.
2-3 months. So you can go
Usually.
every week for that.
So we can go every week, but when here in Paraguay, when the baby is fine, like it sounds bad, but when they are just fine that they won't die, they just let him go because there are another babies that need those cradles. So when the baby is released from the hospital, they have to come here until the retina is fully developed. So that's when the doctor says, okay, you're fine, you won't have ROP, you won't be blind, so see you in 6 months for another checkup.
Yeah.
Okay. Our main criteria are 34 weeks of gestational age, like 7.5 months, and 1,750 grams. 1,750 grams or less. One of those two criteria, we have to see those babies. Because those are the main criteria here in Paraguay. Other places are less gestational weeks or more gestational weeks. In the US, I think it's more.
It's more.
Because
1,500 grams.
1.500 gramos en Estados Unidos.
15,000. Oh, okay, yeah, less, because the care that hold on, sorry, like it's messing up in my head.
Tranquilo.
The way that they taking care of the babies in the US is better. The prenatal controls are better than here, because like a third world country, many of the mothers won't go to their prenatal controls. And also these hospitals that we are covering, they're having families that are from homeless people who are in drugs, sometimes women that are in jail, and they have no prenatal controls over there. So suddenly they came with 6 months of pregnancy and says, okay, it's time, I have to have this baby, and they have no resources, they have nothing, so we cannot charge them for the service. All the service in the hospitals are for free. We cannot charge them, so Cindy is our savior here.
El motivo también, traducime después, el motivo también por el cual en Estados Unidos tienen criterios más bajos es porque los cuidados neonatales son mejores y más estandarizados. Pero acá tenemos que ver bebés más grandecitos por los cuidados neonatales.
Justo lo que le estaba explicando.
Sí.
O sea,
neonatales, vos le estabas explicando los cuidados prenatales.
Also, the neonatal cares in the US are much more standardized than over here. Here we started with this department in 2004. Since 2015, we are like formally a department of Cornea Vision, and one of our goals was to teach to the medical doctors in the neonatal units to take care of these babies, because ROP is because one, prematurity, and we cannot change that. But the other things at the neonatal care, resucitar in English.
Resuscitate.
Resuscitate. I love it. They have to resuscitate the baby, and those are things that usually happens here. In the U.S., that's not that common.
Mm-hmm.
So that's why we have bigger babies to screen here than in the U.S.
Mm-hmm.
Well, that's from ROP. Sorry?
Statistics.
Okay. That's your department. Actually, I don't remember it very well.
No, y de los 115,000 bebés que nacen en Paraguay, de ellos 8 a 10% son prematuros, de ellos un tercio tienen criterio de riesgo,
Okay.
y de los cuales 4 a 5 se tratan aproximadamente. ¿Y cuánto tratamos nosotros?
Okay. Actually, we have 150,000 newborns per year in Paraguay. 10% of that those babies will be premature, between 8 and 10%. 1/3 of those premature babies will have criteria for ROP. That will mean like 3,000. We screen 700 a year. The other babies are being screened. We hope, and we pray to God that happens, that they're screened by another services, like the Paraguayan Social Service, another 2 hospitals that have ophthalmologists on it, and well, that's it. Itagua Clínicas, IPS.
Yes.
IPS is the hospital of the Social Security here in Paraguay. There is another hospital that is from the medical school, from the National University of Asuncion. That's the Clínicas Hospital that is near here. And there is another hospital that has an ophthalmology internship too. That is the Itagua Hospital. So those are the 3 another services that can be taking care of the premature babies. We don't have their numbers, so we're just praying and hoping that those babies are being seen by this doctor, by these services. That was German. Well, that's from ROP. Well, the baby has to be screened from the 4th week to the 6th week after they're born. So 1 month or 1 month and a half after they're born, they have to be screened. And there they go to the circuit. After the treatment, they go to the screenings again to see how the treatment goes. If they need to be retreated, we retreat them. We treat them with bevacizumab, like an intraocular injection.
Mm-hmm. Intravitreal?
Intravitreal injection, yeah. With
Intravitreal
bevacizumab,
injection.
the commercial name is Avastin. I think that's a drug.
Avastin is the drug?
It's a drug.
Yes.
Bevacizumab is a drug.
Okay.
It was developed for colon cancer,
Mm-hmm.
but it works for any kind of retinopathy,
Mhm.
diabetic retinopathy, age retinopathy, or
Yeah.
premature retinopathy, because it make the vessels grow normal.
Mhm.
So it works too. It's not FDA approved, but it's like a non-label drug
Mhm.
that we use. We inform to the parents. We have their permission for any treatment or any screening that we're going to do. I think here in China or even in North Korea, you cannot touch a baby without the permission. Well, I don't know North Korea, but without the permission of the parents, you cannot touch a baby.
Mm-hmm.
So we explain to them what we're going to do, what is their ROP. We give them some information about the importance of the checkups, of the screening
Mhm.
and everything, even when they get out, when they are released from the hospital, that they have to, it's their responsibility to bring 2 babies here,
Mhm.
even in front of the law.
It's a law. They have to bring babies back?
No, it's, well, kind of. It's a kind of law that they have to bring the babies for their follow-ups, for the screening, to keep them screening over here too.
Pero de todas maneras siempre les llamamos.
Yeah, anyway, we just call them again and said, remember your baby has to be here this Wednesday or this Friday, here in 2 weeks. Please bring them, because we have some situations where the parents just are no confían.
They don't trust.
They don't trust. Thank
have
you.
the commitment
They
to-
don't trust in the service, or they say, as crazy as it sounds, they say, why are you so interested in my baby? What are you going to do to him? Are you going to experiment with him? What are you trying to do? Yeah. And we have to say to them, okay, it's your responsibility. We just gonna let know to the police that you're not going to bring your baby here, and then just hurry up to bring it there. So that's from ROP. I think I covered it all, right?
Yes.
Yep.
The Cornea Bank, I think they told us they make an approach right now, so they
They're
don't.
making a harvest right now.
Yeah.
Oh.
Well,
Yeah.
the Cornea Bank, here we treat, it's funny because in this room we treat with the newborns and the new dead. So they harvest the cornea from the donors. They process here the cornea, and they do all the quarantine to see if it has any virus on it and everything. With the medical director, when the medical director approved the cornea, they send it to the operating room so they can do the transplant of the cornea. They harvest from donors from 12 to 70 years old. One cornea harvest, it works for 2 patients. One for the corneal transplant and another for a scleral patch. Let's say if you are an iron worker who was cutting an iron and a piece of iron just go through your eye, because we don't use safety goggles over here. You know, man's weird, like, I don't care, nothing will happen to me. And little piece of iron go right through the eye. So they have to patch this. And that's why they use another part of the cornea. What they do with the transplant is they cut over here and put it again here, and to the transplant, to the patch, they put it here.
But the same part, or?
Yeah, could be. Let me show you. This is a cornea, actually. I used one. You can see that in the middle, it has like a little hole. That was the part that they cut it to the transplant. And this white part, they use it for the patch.
Ah.
The scleral patch. You can have it.
Very good.
And they preserve that in that liquid for 15 days. Since they have, from the harvest date. It works for 15 days. Because it has some epithelium cells.
Epithelial.
Epithelial, yeah. I just made a new word.
No, it's great.
Epithelial cells, they have to be at least 2,000 cells for the cornea to work in the new patient. When it has less cells, they put it in this liquid. This is glycerin.
Glycerin.
Glycerin, yeah.
Okay.
And yeah, in glycerin, the cornea can be used since 2 years after the harvest date.
Oh.
But that is only for patch, not for
Only for
cornea.
patch, yeah, not for the cornea
Not
itself.
for the cornea itself. It's for the patch. The white part, the sclera, that's what they use for the patch.
You can still use this for the patch. So I have a question.
Sure.
Given the law that everyone has to donate
Yep.
cornea, right, after they die?
Yeah, it's thanks to this little girl. She's Anita. she actually died from a heart disease, I think, waiting for a heart. So, based on her case, they present a new law that it was approved now. It is the Anita's law that says that everyone in Paraguay, every Paraguayan is a donor. At least that you by how do you say escribanía?
Yeah, like you have to go to a notary and
Yeah.
say like, okay, I do not want to be a donor. But if
Exactly.
unless you do that, you automatically are.
So you
Are-
automatically opt in
Yeah.
to donate,
Unless,
whereas us we have to opt in to be a donor.
yeah. Here you have to opt out.
You have to opt out.
But
Smart process.
yeah, but in the real life, well, when someone's dead and it says, like, let's say I die, no, not yet, but then, and I says to my parents and everything, I want to be a donor. Use my organs and whatever you want to. I won't use it over there, so. But my mother or my brother or my uncle says, no, I don't want it to be a donor. We cannot harvest the organ or the tissue.
Mm-hmm.
We can say to him, by law, he is a donor, at least he told by a notary that it won't be. And we have to call a prosecutor to take notes of everything, and a judge has to says, okay, he is a donor. Will be like 12 hours to 1 day, so the tissue will be done. Will be gone by there. Organs, I think that you already know that organs can be harvested with biological life. Tissue, no, we can wait for the cornea. We can wait like 8 hours in a hot weather, almost all the year in Paraguay. But when it's cold, till 10 hours.
Okay.
And
So you have to do it within 8 hours of
Yeah.
death.
this is the piece of the cornea that they cut to make the transplant. And this is like a transplant cornea, you see? With the points on it.
So is there still then a need for, is there still a shortage of cornea?
Yep, it
So
is.
still
Waiting list,
don't
I
have.
think, of 60.
Fundacion waiting list.
What's
That's
the,
our waiting list.
Our
Your
waiting
waiting
list.
list?
From the
But
country.
national waiting list is like 190 or something like that.
190,
Persons waiting for
190 people
waiting for a cornea.
waiting for a cornea.
Yeah.
And then Fundacion's is
60 maybe.
60 people
Yeah.
waiting for a
Yeah,
cornea.
from the
But that's the
patients-
waiting list, so those
Yeah.
are the
From
people
the
with cornea
patients we
less.
know that come to consult and then get in the waiting list. Like, that's what we know of the patients who consult here.
Mm.
Yes.
Yeah.
Would they be willing to accept like artificial cornea if those were developed?
I think not yet. They're not approving over here that yet.
Artificial cornea?
Yeah, would be great.
Does it exist? So I was curious.
I heard something about pig cornea.
Pig too, yeah.
Yeah.
So
They are
exogenic.
trying to do that. They're having some experimental
Mhm.
cornea transplants with pig cornea,
Mhm.
but we don't know nothing about that yet. So
Mhm.
over here, just the regular natural.
Do
freshly
they
dead
have to
cornea.
do a new clinical trial for, say, an experimental cornea here in Paraguay, or is there somewhere
Somewhere.
similar that would, like a country that would be similar to your population that you'd be able to?
About those big corneas.
Well, for anything. So if it
I
was like
think
it's
India.
close enough, and then
I
would
think
be able to
India is
accept.
the one that they
India?
try. Yeah, they always try everything. So I think they are the ones who
They would be
trying,
equivalent
Yeah,
for you. Okay.
they're trying to, because they have a lot of need over there with the population and not too
Huge
much
need
yeah.
for corneas.
Yeah. I think they are trying with
Okay.
the artificial corneas and big corneas. I think I'm not pretty sure.
Yeah, yeah. But if would their trial be acceptable? So like in America, we have to have data from certain countries
Yep.
to say that that's an okay
Uh-huh.
thing to do now in America. Do you have something similar, or they would just say it's close
Kind
enough?
of. Yeah, we have kind of similar thing like that. So, I mean, when it is U.S. approved, to say like that, we already know that that it passed through a lot of tests and a lot of trials.
Mm-hmm.
That's why we always hear trying to use the FDA approved drugs and everything, because we know that they are passed through a lot of trials and tests to be approved. At least we hope that. Okay, let's keep it like that.
Close enough. Uh-huh.
That's why we always look at.
So you look at if it's FDA, is it Europe? So
Yeah,
European trademark, if it's
Yeah.
EU
Every
approved.
year, the Florida Cornea Bank, through another foundation that is Panambi Foundation. Panambi is where I work for butterfly. So they get us like since 2018, I think. They can get like 16 corneas from the Florida Cornea Bank.
Oh, from Florida.
Yeah, donate.
Okay.
So they send us the cornea and we transplant here to help the people that we can.
They don't know they Floridian
Yeah.
corneas in their eyes. Cool.
You can see the beach with that.
You can see the beach. Beach eyes.
Well, that's I think
that's it.
yeah. And they process this tissue over here, I think, and over here, and they produce the amniotic membrane. Sorry, membrane sounds like a French painter. Amniotic membrane. They use this amniotic membrane to patch some parts of the eye, from the retina and from the pterygium. You are familiar with that kind of little flesh growing over the eye? Flesh.
Like some people like have like this little fleshy
flesh
growth,
that grows,
like
over
on the
the eye.
grows over the eye.
Oh, okay.
That's, we call it pterygium. I don't know how to say that in English. Well,
Google Traductor.
yeah, Google Translate. Saying Google will answer. Well, with that disease, what they do is they, excuse me, Marty. This is Marty. You see? Marty. Well, when that flesh grows over here, over the eye, they have to raspar.
Yeah, like scrape it.
The script, yeah, with a scalp and another instrument. So when they're done with the little flesh, they have this little tissue over here, and they have to stretch it and sew it, right?
So
So yeah,
Pterygium.
pterygium. Yeah, it's the same. With the amniotic membrane, this you just put on it. You don't have to stretch that little tissue from the bottom of the eye, and it heals faster, safer, and it won't affect the visual acuity of the eye after that. So that's why we're using now the amniotic membrane.
So in America, women can keep their amniotic sacs. Do they have to donate their sacs?
Yeah.
Yeah, after.
After cesarea, not natural.
Oh, after natural or
No, natural.
C-section.
not natural? After
natural.
C-section.
Yeah, because with the natural breed, no,
Birth.
birth. Sorry. With the natural birth, the sac it's contaminated.
Oh, right,
Because
right.
with the baby comes everything.
Everything,
Yeah.
including fluids,
Yeah,
fluids.
any kind of fluids and everything. So with the
C-section.
C-section,
C-section.
cesarean.
yeah, with the C-section, the sac won't be contaminated.
And
It's
that's
clean.
so that's viable to use
Yeah.
for. Oh, very cool.
They have to process it. Let me show you the laboratory.
Yay. My camera's dead. I'm eating it now.
Actually, we have another cornea over here. Ah, no, we don't have it anymore. No, that's them. They are our clinicians. He's Osvaldo. Over there is Francis. They are the ones who take the wide field camera to the hospitals. So over here, this is a laboratory where they process everything. They storage the amniotic membrane in that little fridge to minus 77 Celsius degrees. In Fahrenheit, I don't know how much that will be. They storage over there the corneas in those two fridges, and that thing over there, it's like, they call it, is to work,
It's a clean spacer. Fume hood?
yeah,
Fume hood?
no, it's for sterile,
Sterilization.
yeah, it's a sterile space, with continuous flux of air that is, it's cleaned by 2 or 3 filters and UV light to kill all the germs and have that space pretty sterile. So there is where they have the ophthalmological shots of Avastin. And that's it.
Thank you.